First, how do you as surgeons prepare for this procedure, Dr. Llaguna?
Well, a lot of talking. Typically, it's definitely a team approach. You know, I sometimes see a patient in my office, or John will see a patient. We'll call each other. We'll run the case by, you know, by ourselves. We'll sit down. We'll review the imaging to make sure that we're on the same page with regards to the distribution of the disease. We'll review pathology. We'll have the patient bring in any pathology they have from the outside institution so that our pathologist can review it. Every week we have a multidisciplinary tumor board, both in the GI oncology group as well as the gynecologic oncology group, where all these cases are presented. And in that meeting, we have the medical oncologist, radiation oncologist, myself, our other partners, geneticists, everyone who's involved in cancer care, so that we'll review the entire case. We'll give our opinion as to what we think should be done, and we get a consensus statement from the group, from the tumor board, saying, yes, we think you should proceed with treatment A, B, and C. And then, you know, like I said, every patient is seen by both myself and Dr. Diaz, and probably roughly within a week's worth or 2 weeks worth of reviewing all the data, then we come up with a plan, and then we, you know, give that opinion to the patient.
All right, so now let's shift gears to the patient. During the break, I was talking to the doctors, and they brought up a pretty interesting point that I want to share with you, which was that there are two types of patients. There are those that have read about this and want to learn more, and then there are those that are unaware of it. Can you chime in on that, Dr. Diaz?
Yeah, so some of our patients are very well educated and are able to find a lot of good resources on the internet and even our own web pages about the procedure and about this option for them. Some of our patients have never heard about this procedure before, and so when we first broached this approach with them, they're excited to hear about the possibility of improving their outcomes with this procedure. But it requires, as Dr. Llaguna said, a lot of counseling and telling these patients really all of the benefits, but all of the risk associated with this attempt.